people, why everyone got so quiet? Gee, come on.
I know.
I call it
Panels
sad.
It will be, right?
Sorry, just scroll down.
I think that's part of what people are looking for anyway, is they want to feel like, oh, these are real people.
Right. That's not your people.
Yeah, right.
I've never said
No,
not in real life, at least.
no, never. Certainly not.
Thursday, Friday.
No. No.
Okay, it says it's live.
Hi there, I'm Dr. Demetre Daskalakis, the Deputy Commissioner for Disease Control at the New York State Department of Health, and I'm here at Bellevue Hospital, and I'm welcoming you to our Pride Month Facebook Live on staying healthy. Again, I'm really excited to be here at New York City Health and Hospital's Bellevue Hospital. I actually get my care here. My doctor's over there. You're going to meet him in a moment, in Manhattan. And I'm here with some of my friends and colleagues to talk about healthcare for LGBTQ people and other communities and why it's important to work your best to find services that are right for you. So really, in recognition for Pride Month, I'm proud to be sitting with my colleagues here and my friends who all are part of the LGBTQ community. So we're not just talking about things that are theoretical, they're things that have touched our lives and really have molded the way that we approach the work that we do every day. So we really want you to take a listen to our comments, hear what all of my colleagues say, and then if you like it, click like on Facebook and share this feed with any friends who you think may be interested. So even though we're not live, you're going to be able to hear about this later on. So speaking of my friends and colleagues, I'm going to introduce everybody. So with me today are Dr. Richard Green. This is my doctor, Dr. Richard Green. He's a primary care physician here at NYC Health and Hospitals. Sarah Bender over there, who's the Associate Director of Gender Equity at the New York City Health and Hospitals. Arianne Napier, social worker here at New York City Health and Hospitals. And last but not least, Brandi Concepcion, who is someone who seeks care at Metropolitan's Pride Health Center. So
Hi, everyone.
she can speak firsthand. Good.
Okay, hi. Basically, I started my surgical part of my journey at Metropolitan Hospital, which provided very personal service beyond what I had expected. All of my expectations were far met by the people who worked there, from the staff, the doctors, the nurses, and everyone else.
That's great. So we're starting with the great story of how somebody sought out care at Metropolitan. I'm going to circle back a bit and talk about to the folks who are working for health and hospitals and ask how they really got into providing LGBTQ community health care. So really, let's just start by everyone saying, I'll start with you, Richard, Dr.
Sure.
Green. How did you get into improving the healthcare of LGBTQ communities?
So it started, like you were saying before, that I had interest in taking care of the LGBT community. I knew I wanted to be in medicine, and I started off largely around HIV and AIDS and taking care of gay and bisexual men who have sex with men. And then sort of my interest expanded, and I learned more about the community and realized that the conversations that people in healthcare were having were really limited, and I wanted to be someone who expanded that, right? I wanted to talk about the kind of pride that we have in our community, the kind of relationships that we have in our community, in a way that was really affirming, that made people feel good about their identities when they came to seek healthcare. And so I've been working in the health and hospital system for 11, 12 years now as an attending, and 3 years before that as a resident. And I just love this system because it really does we take care of everyone. And it allows me to do work that I really care about here.
Great. I'm going to ask Arianne the same question.
Yeah.
How did you get into all this?
So I'm Arianne. I'm the palliative care social worker here at Bellevue. This work, I think much like Dr. Green, has come from a personal place. So, part of my upbringing was raised in a Black queer community of primarily Black queer women. And so this work has come from sort of being in those spaces and listening to people talk about their access to healthcare, talk about their experiences that were unfortunately often discriminatory or stigmatized or limiting in other varying ways that were just not affirming to who they were. And so as a Black queer woman myself, having interacted in these spaces, but also really wanting to feel a sense of control and provide better care, and then sort of help other people do that too.
Great, thank you. Sarah, you're up.
All right.
How did you get into all this?
So I think for me, it's always been a human rights issue. I think at the end of the day, we're talking about folks who historically don't have access to the kind of care that cisgender, heterosexual people have access to. And for me, healthcare has always been a human right. And I also come from that same place of my own personal experience and just myself as a queer woman being asked super inappropriate questions by my providers, not really knowing where to go for information, feeling like, you know, maybe I'm just not going to go see doctors anymore because it's always really awkward and uncomfortable for me. So when I started working for health and hospitals about 4 or 5 years ago, it was just like, enough is enough, and LGBTQ communities need to be able to come and seek the same kind of comfort and wellness, I guess you could say, as cisgender people, as heterosexual people, without all of this extra worry. And that's what really drives my passion for it.
Can I just ask a quick question to all of us? So I think we're coming from different perspectives. We have doctors, folks who are looking after the sort of administrative side of trying to make LGBTQ healthcare better, social worker, and a patient who is seeking out care. Who has had an experience in healthcare that they felt was not good because of who they are from the perspective of being an LGBTQ person?
I could help you with that.
Amen. So, I mean, so it's not just like
Yeah.
people on the street, it's like everybody. It's not like an us or them. Like, so we come from the experience of having trouble identifying providers and help us. And so I'm going to segue back to you, Brandi, because I want you to talk a little bit about how you found that good care at Metropolitan Hospital Pride Health Center in East Harlem. So how did you find those services?
Short answer to that, Google. It will tell you everything. However, as far as my story goes, I moved to New York about 10 years ago, seeking to further advance my transition, since where I came from, it was done. There was no help for people like me. Back home, I visited 10 endocrinologists, which all turned me down for HRT, hormone replacement therapy, 2 mental health professionals who insisted upon the fact that I am not transgender, I am just confused or depressed, and just loaded me with pills. When I moved to New York, I actually found care for people like me, and I felt like there is a place that I belong. So that is my story.
That's great. I think that finding a place where you belong is really what the story is here at H&H. So my experience, and briefly, because I think technically you have 2 patients on the panel,
That's true.
is finding a LGBTQ sensitive provider or responsive provider is not that easy. And one of the things that I remember as a doctor myself at Bellevue was when someone would find me, they would say thank you like it was some huge thing. And it was frustrating for me to say it shouldn't be a huge thing. You should be able to find someone who cares for you, and I think that sort of this loving group of individuals who you have around you who work so hard to make the environment so great here, I think really speak to that. You know, from the minute you walk in the door here, there's affirming signage. Like I walked in, I'm like, I'm okay here, and I do this for a living, and even for me, that one moment of seeing like that there was an attention to our community is so important. So I want to ask Sarah another sort of follow-up question, because you worked so hard to sort of create the environment in Metropolitan. So what was your vision? Like, what did you want that to be like?
I think I thought of what I would want when I go to the doctor, and I hate going to the doctor, regardless of what my assortment of identities are. I get super anxious about healthcare issues, and so there's always this extra layer of worry though about how am I going to be received as a queer person. So I think first and foremost, when we're building out our services that, you know, so we actually have multiple Pride Health Centers around the health system. Metropolitan is one of them. That's where I was lucky enough to meet Brandi. We have another Pride Health Center in Woodhull, which is in Brooklyn. And then we have a couple of other hot spots around our health system that we really feel confident in the delivery of affirming healthcare for LGBTQ folks. Gouverneur is another one I'll call out in downtown Manhattan. Judson Health Clinic, also downtown Manhattan. And so as we're looking at all of the places where we deliver healthcare and making sure that they're affirming to LGBTQ folks, I think it's just about, are there people there that when you arrive, you feel safe and taken care of? And that was my vision when I first started working at Metropolitan, was how can we make sure that when a patient comes through the door, they see the signage, right? We're showing people through what's on the walls, what people are wearing, how people are acting, how people are being addressed, hopefully without gender pronouns being used, or with gender neutral pronouns being used. You know, how are we telling folks that you're okay here? And so, you know, that's kind of my drive now as well, you know, for across the health system, is making sure that we have someone who's a first point of contact, which is typically me, to make sure that there's a person that you can reach, not just a voicemail box, not just an email address, but an actual person that will walk you through whatever it is that you need. connect you to the people who are going to make you feel safe and taken care of.
Great, thank you. Dr. Green, I'm going to go over to you for a second and ask you to tell me a little bit about sort of what you think are some priorities in LGBTQ health, specifically sort of in the sort of biomedical world and sort of the world of taking care of people. What do you think is a hot topic?
So there are a lot of them. I think largely to take off of what Sarah was talking about making people feel safe and comfortable, I think it's really important for us to both honor people's gender and sexual orientation, but also to talk very specifically about medical things that might impact them, right? So one of the biggest interventions that's come around lately is PrEP, which is pre-exposure prophylaxis for HIV. It's a 1 pill, once daily treatment that can actually prevent HIV in people who are at risk. And a lot of people think about it only for queer men, cisgender men, but it really is an intervention that's great for a lot of people. It's great for anyone who's in a relationship with someone who is HIV positive. It's great for trans people, both trans men and trans women. Even though some of the data is lagging behind, it's definitely an intervention that we want to talk about. And it's really changed the conversation in many ways. So PrEP, a lot of people think of as similar to the birth control pill to sort of prevent HIV. But what it's done medically is that it's really changed the conversation that we're having. For so many years, the conversation medically about HIV was all condoms, all the time, forever, period, end. And we knew that that wasn't realistic. We knew that patients weren't always doing that. And PrEP has really expanded the way we can talk about sexual health, right? The way we can value and appreciate that sex is supposed to be enjoyable and that a healthy sex life is part of a healthy life. And so to be able to have a conversation that revolves around what are all of the options for protecting yourself is amazing and huge, particularly for our community.
So you see why I go to him. So, I mean, the fact that you have a doctor and another provider who can look at you and say, sex is for fun and that's okay, I think is really telling you like what our environment is like here at H&H and really speaks to the importance of really open conversations. And I just want to say that we've covered the subways with ads about pre-exposure prophylaxis, but all of the action happens here because providers are providing PrEP here, and Harlem Hospital, I've heard and I've seen actually, has also begun a really great educational campaign on PrEP. So really great movement.
Can I interject something just because you mentioned this earlier? Please. One of the most wonderful things about my job taking care of the LGBTQ community is that when I start to have these conversations, people will look at me and they will take a deep breath or a pause and they'll say, no healthcare provider has ever talked to me about these things before. I have a patient in his 70s who said, no one ever expected that I would have a sex life. Like, nobody talks to me about that. And that's not okay with me, right? That's why I do this work.
But don't let him trick you. Along with all the LGBTQ help that he does, smoking cessation, diet, cholesterol management, it's all wrapped into the story of keeping people healthy. It's not just sex, but if sex is an important part of your life, this is what the comprehensive care like is here, which is great. And speaking of comprehensive care, I'm going to go to Arianne one more time to ask about what the hot topics are for you. Because you, I think, deal with people in really important moments in their lives, and I'd love to get your sense of how the LGBTQ work touches that.
Yeah, absolutely. So, you know, part of the work that I do, I think is, I mean, much like everyone has said, is providing providing care that sort of meets the very specific needs of the person who walks in front of me, of the patients that we care for and their family members. So, you know, from a social work and clinical social work perspective, you know, a lot of my care is related to end of life, but also just across the spectrum of illness. And so thinking about how do your identities impact and how do your identities impact your care, and how does the way that you live your life impact your care, but also addressing those things. Sometimes I self-disclose and identifying as a queer woman and talking specifically about what is important to you, and speaking directly about what is important to you and how you live your life. And self-disclosure is a great way to, I think for me in my practice, to help people become more comfortable and for us to have an understanding of who is in the room, and what are the stories that we're bringing into the room when we're talking about healthcare and when you're walking. And I think that is a really important way to sort of neutralize some barriers in a healthcare setting that can feel stuffy or containing or limiting.
Sarah, I'm going to jump to you for 1 second. I was going to ask you a question before we go back to Brandi, because Brandi had a big question for you. It's coming up. So Sarah, is PrEP available to people in the general public? So I know Richard can speak, and Dr. Green can speak to sort of the medical aspects, but what is your sense? Is it something that everyone can get?
everyone should be able to get PrEP, yes. And theoretically, everyone can get PrEP. I think the issues that we face relate to access to care and specifically access to insurance and what kind of insurance you have and what the copay might look like for the medication. PrEP is available at all of our facilities. It's something that should be available in primary care, as Richard was talking about. I think, we want to make sure that if patients need PrEP and are having difficulty accessing it because of a payment issue, that they bring that information to us so that we can make sure that we help navigate them around all of the different options that are available, because there are options available. If the copay is unaffordable or if the person doesn't have insurance, we can help make sure that they still have access to the medication.
So we have a question from online to Dr. Green. We want you to comment on that as well. Is it for everybody?
So is PrEP for everyone, meaning can everyone access it, or is it for everyone?
Both.
So I agree with Sarah. Everyone should be able to access it. We do have a specific PrEP clinic here at Bellevue where if you get your primary care here, you can also access PrEP, which is great. The people for whom it's appropriate, and this is a conversation to have with your primary care provider, but is for people who have risk of contracting HIV. And so we think of that in a lot of different ways, right? What is the kind of sex that you're having, and is that something that puts you at risk for HIV? And who are your partners, and are your partners at risk for HIV? Because if they are, that might be something you would think about. If someone's ever had a history of having a sexually transmitted infection, particularly like gonorrhea, chlamydia, syphilis, those would be great reasons to at least think about PrEP and to have a conversation. And one of the things that we're noting is that people who are screening sometimes are forgetting to refer people or mention PrEP, right? So you might see your gynecologist, and if they're not super informed about it and you have a positive test for gonorrhea or chlamydia, they might treat you for that, but they might forget to mention PrEP. So if they do, that's definitely a question that you should think about asking. And if you don't know, certainly they can always ask one of the primary care providers in any of our facilities.
That's great. So Brandi, you're up. I'm ready to ask you my big question. You talked about your voyage and sort of getting care that was appropriate for you and what you found in Metropolitan. But I want you to step back a little bit and tell me, really, what are the sort of big barriers that people are facing who are now walking in your footsteps? So what do you see in sort of the younger population and other people who are just sort of identifying themselves as transgender? What are you seeing?
I started transitioning late in life. I always had to do the manly man kind of stuff, join the service, learn how to work on cars. That was more my path at the beginning, even though I was never happy doing any of that, but I did it because it was what was expected of me. Once I came around to realizing this is who you are and this is what you are, it became a little bit easier. So I would like to speak directly to the folks who are a little bit older, starting on their transition. Don't give up. I mean, just keep going. And if you don't get the answer you need from one physician, move to the next one. He doesn't need to have all the answers. You need to do the legwork and to find who's able to help you. Also, another point that I wanted to touch on was transitioning is not only about surgeries and changing your identity. Transitioning is a part of what you are and who you are inside. It takes a lot of different colors for different people. It doesn't mean that you have to be passable. It doesn't mean that you have to be the perfect woman. It doesn't mean any of that. It means that this is the real you. This is the person that you came out to be. And for that, if you can go that far, you should just love yourself for that.
That's a really great message. I think that one of the things that we've heard, not just from trans New Yorkers, but from all LGBTQ New Yorkers, is that it's really hard to do that legwork. And that very often when you land in a medical environment, people don't really acknowledge that you have sort of a set of rights that you really should get. Like you said, healthcare really is a human right, especially in New York City, where we really believe in that. So I think a couple of things that we've done to try to make that legwork easier is we've created the New York City Department of Health a LGBTQ healthcare Bill of Rights, which is the first ever Bill of Rights for LGBTQ people seeking healthcare that we've heard of in any jurisdiction. So in typical style, New York City leads the way. But the other piece of that that's so important is that we really ask New Yorkers to bear it all, to tell their truth to their provider, and if they can't, to find another one. So I'm going to talk to Sarah about how Health in Hospitals helps people bear it all to find providers that work for them.
Yeah, I love that campaign. And it's totally true. Like, if you don't feel comfortable talking to your provider about who you are, about your gender, about your sexual orientation, about anything that's not related to your gender, sexual orientation, find another provider, because we should be able to feel seen and heard and validated when we're in a healthcare environment. So like I mentioned before, I think for me something that's so important is having a personal connection with someone. I think hospitals can seem really sterile, as Arianne mentioned, stuffy, as you mentioned, big, difficult to navigate. I got lost finding this room that we're sitting in today, and I come to Bellevue very, very frequently. And I think having that personal connection is really important. So something that's actually associated with the Department of Health, or with the Bear It All campaign, is that the Department of Health has this really great map. So step one, you can go online, and we'll post the links to all the things I'm about to say in the comments. But you can go online, you can search by your location to see what kinds of services are available that have already been vetted by DOH staff as LGBTQ friendly. In terms of that personal connection for us, I am always available to everyone. We have an email address that is system-wide for all of our facilities. It's lgbtq@nychhc.org. Again, we'll post all of this in the comments. That email address goes right to my inbox. So if you can't find what you're looking for on the internet, if you can't find what you're looking for on the DOH map, if you've already been to our website, which we'll also post in the comments, and you can't find what you're looking for in the series of phone numbers there, you can email that email address, and someone, likely me, will answer you within 24 hours. It's a promise that I make very often, and I feel strongly about keeping, because I think
she keeps them.
As we talked about, I think that, again, that personal connection is super important. And we have this internal network of folks who, we can reach each other very, very easily to make sure that everyone has access to what they need. I think we're trying to make our large and looming health system seem a little bit smaller, a little bit more neighborhood-centric, and again, foster that personal connection.
So, a couple of other questions just to talk about. So you specifically, I just want to say one quick thing about that, which is that I think really the flavor at health at hospitals, it's a big system, but people who care really make it feel like you're being ushered through. So I think folks like Sarah, folks like Richard, folks like Arianne, really are telling you that this is a place where it's safe. And even though New York City is a big place, your family here is tight and small. And so, I think there's a reason that all of your sites are listed in our New York City health binder. You can actually find good places to send folks. So, we went through them, we vetted them, we asked questions, and the H&H facilities flew through with flying colors. So like I said, I get my care here and you get your care here. So we're voting with our feet, so you should vote with your feet too. But there's but we really talk about one thing which I think is really important, because I think the LGBTQ experience intersects a lot with other experiences. Mm-hmm. And so one of the things that I think is really important to think about is how being queer, being lesbian, gay, bisexual, trans, interacts with other aspects of your life, like being a woman of color or being a person of color. So can you speak to that a bit?
Yeah, so I think, both from a personal perspective, but also from a professional perspective, identifying as a Black queer woman, but also in my role here as a clinical social worker, I think what's important is practicing for me from an intersectional place. So, thinking about when someone is walking in the door to me, what are the historical, cultural, social pieces about who you are? And here at Bellevue, we care for everyone who walks through our door. And so sometimes that also looks like caring for people who are undocumented and who are uninsured, and when there are language barriers, and how do we provide the best care for you? And so also thinking about those perspectives and the specific and individual and the unique experiences of being lesbian, of being gay, of being bisexual and trans and queer, and what that looks like. And so part of the ways that I do that is sort of just generally being open, but also when speaking more, personally with people, I think we just need to think about what are the historical places that you're coming from, what's your historical narrative that you're bringing with you when you walk through the door. So, has that been discriminatory? Has it been stigmatized? Has there been, medical mistrust of systems, and assessing for those things and figuring out how we can take care and be gentle with you. Yeah. And so I think I think we should ask about some services.
Yeah, so we talked about sort of intersectionality of being a person of color with LGBTQ, but I can tell you that in my experience working at Department of Health, one of the more challenging groups that we have are adolescents, so folks who are younger, because their needs are so different, and the system in so many ways has been built to be harder for them. So how do we make it easier, and how do we address youth, my favorite topic, and being LGBTQ?
Yeah, so, we want to make sure that there's no wrong door in our health system, right? That our goal is that there's no wrong door for folks to come and get care. We have a couple of hotspots that do really, really great affirming adolescent and youth care. I called out one of them earlier, which is Judson Health, downtown Manhattan on Spring Street. I'll even call him out by name. Dr. Mark Bezier is a hero provider. And Gouverneur as well, their general pediatric and adolescent health departments are great. But we really want to make sure that every place that we're providing care, that we're providing youth care, we're providing really good adolescent health services as well. So we've been really beefing up our services, particularly in terms of support services for trans kids and their families. So if you're watching and you're a trans or non-binary kid, or you're the parent or guardian of a trans and non-binary kid, and you don't know where to go for support services, you can reach out to us. We have a number of locations around the system that do really, really great affirming care for trans kids. We're also been partnering with a lot of other city agencies to make sure that all of the needs of our young people and our adults are taken care of. So, when we're talking about the health of an individual, we're also talking about their home and their job, if there is one, and everything else about their lives. So I'll give a shout out to the Unity Project as well right now, which we'll post the link to in the comments. But there's this great interagency collaboration resource page online that we'll post the link in the comments, that kind of goes through all of the different resources that are available specifically for youth. And I'll also give a little shout out to an event that we'll be at tomorrow evening at the center in Chelsea on 13th Street, which is a LGBTQ youth and family resource fair. So there'll be a number of city agencies, other organizations, community partners tabling and there to answer questions for any young person or anyone who spends a lot of time with young people or who is caring for a young person should come by the center tomorrow night as well.
Parting shots. Everybody gets a sentence. What do you want New Yorkers listening to this Facebook Live to hear?
I want LGBTQ New Yorkers to know that they should come in and see a provider here at Health and Hospitals for comprehensive care. I love that you called out that, I don't just do PrEP or LGBTQ care, but comprehensive primary care. And one of the nice things is getting people in so you can do preventative health services that are indicated for everybody. And I think it's important for us to take care of our health. I'll end on that.
Perfect.
Similarly, I would just say I want you to know that, if you see me here in a Health and Hospital Bellevue or another Health and Hospital center, that feel free to ask me any questions, to, talk to me about your experiences. I'm happy to listen and to provide support as people need it.
Brandi, I'm going to skip you because you're going to get the last word.
You keep skipping me. I'm going to take this personally.
No, it's because I want you to finish it and we have questions. So Sarah, you're next.
So I guess my parting thought would be that this is just the beginning of our conversation, and I think if you're watching this, or either right now or later, because it's going to live on our Facebook page probably in perpetuity, which is why the internet scares me. But if you need something, reach out. We're here, I'm here, all these folks are here, many other people are here to answer your questions, connect you with services, and just to lend an ear and hear what's going on and make sure that you've got what you need.
And then the final word before we take questions, Brandi. I'm sure you can handle it.
I don't know. What do you guys think? Not only to the transgender folks, but to the entire community, to the LGBTQ community, it is hard to be us, but always keep in mind, no matter where you are, whether you be in South America, in the Middle East, whether you are in Asia, there is a rainbow at the end of all this suffering and all these problems that we go through. If you're a transgender person, a minority, a transgender woman of color, you could do it. So don't give up.
Great.
There.
Like I said, I knew how to end the show. But we have some questions. The first looks like it's about support services for, there's a Caribbean women's program to help with victims of hate crimes and help find and help support family members. I'm not sure what the question is there, but is the question, is there one?
Yes, there is.
Great.
There is. They are located, or they do a lot of work through the Brooklyn Pride Center. Please contact them. There are two young ladies who I do not recall their name. They are very good and very passionate about what they do.
Great. And I think another question, if I saw it correctly, was about support services for family members of folks who are coming out. So I know that though it's really stressful for someone coming out, I think there's also a lot of stress for someone who may not understand the whole story if one of their family members is coming out. Are there any resources that we have to offer or some ideas?
I don't know if we're allowed to call out community organizations. Are we doing
Yes,
that?
please do.
Okay, so I'm not sure. I don't know if we have any locally, but PFLAG is certainly one organization that a lot of people turn to when they have family members who are coming out. It's been a really helpful organization. It's from a lot of other family members who have been there and have been through the process and sort of worked through it on their own, and that can be really helpful for people.
Mm-hmm.
Another great one is Canva.
Yeah.
So Canva has a great program, which I think is part of the Uni project now too. And Canva is really provides support for families to really make sure that they love their LGBTQ children, because being in a loving household is really the best healthcare prevention you can imagine. So Canva is one that comes to my mind.
Right, and then our network of hospitals and health centers offer a number of different types of support groups through our behavioral health program. So each facility and each healthcare location varies on what is being offered at any given time, but I would definitely encourage anyone who's actively looking for those kinds of services to send an email to that email address that will be in the comments, but again is lgbtq@nychhc.org. I'll say it one more time, lgbtq@nychhc.org. Send us an email and we can let you know what's going on in your area and when.
Any other questions? No? Well, on that note, I want to thank all of the amazing folks who participated on this panel, and happy Pride from H&H.
Happy Pride.
Happy Pride.
Happy Pride.